All right, so YouTube is. Oh,
There's a bunch of food over here.
No, I'm good. I'm good.
YouTube is up and running.
Right?
Okay. Okay.
Right. All right, ready to start? Oh, lights are good. Let me see. Where the hell am I? Here we go. Are we ready to start? Are you going to start recording or not yet?
Yep, recording has started. YouTube has started.
All right, welcome everybody. We're having an exciting night. So this is Fridays with the rest of our team here in the social club educational event, and there's so much to say, so little time. So what's happening to you, Paul, these days?
Nothing much. I've been keeping busy helping out with these videos. I told Dr. Kernew that I started learning French, and he tested me on the spot. Oui, je commence à parler. So I'm getting there. I'm starting, but it's hard work.
We have Sonya is joining us today, and she's our technology coach. Boy, I was looking at your video, the workshop 2 on technology. I gotta watch what I say because I'm on the internet or wherever we are. Is that well done? And I think for people my age, we push buttons. We are afraid to push buttons. Don't be afraid to push buttons. So one of the things is I have an itchy nose right now, so I can't scratch it. So I want anybody to keep track of how many times I've touched my face throughout the period of time. Paul, you can yell at me. I'm keeping an eye on you because
All right.
okay? And if we scratch our face, you let us know what to do. Us guys can keep our hands down below, I guess. It's a nice warm place, I guess, and it's maybe safer. I don't know. So we're going to get people showing up. I see Paul's here again, and we have Big Daddy. We got people joining. Any questions that people have about their health or anything in general? Anything you want to bring up by anybody? Any suggestions?
And I'm going to mention there is a chat on YouTube, so feel free to message there. And everyone here, you've been muted upon entry, so if you do have any questions, you can unmute yourself and ask away.
And one of the things that I'm learning is that you can unmute yourself, and I want you to try different technologies. I couldn't figure out. I was on Zoom the other day, and I couldn't figure out how to get my picture on and off. I now know how to do that thanks to Sonya. I'm not sure when I'm muted or unmuted, so I got to watch that, and we're going to learn a little bit more about that. I'm quite impressed that, man, I've learned a lot. So much more to learn. And does anybody have any medical questions? Chad's here behind me over here. He's 6 feet away from me over here. Here's Chad going over here.
Hey, Chad.
Hey, how you doing, Paul?
Chad's our resident cook. Good guy. He's also my consultant about how to do a better job of sort of protecting ourselves, because I think the new norm is that, one of the things that's coming up is that how much isolation should we have? Should we put ourselves in the bubble for the next 2 weeks to 10 years? Or should we go in the community and just say, you know what, I'll take my chances. What happens? The mortality overall is low for young people. It's high for older individuals and people with disease. So it's interesting is that people are very polarized. I'm somewhere obviously in the middle. I'm a middle child, so I compromise. And so how do you live your life, do good, but also be safe? And I think, there's some ways to think about that. Chad, do you have a thought about that?
I do. Actually, there's a really good episode coming this weekend on W5, CTV W5. And, excuse me, it's about life.
Here you go there. I'll get you away.
It's about life and death with the COVID-19. And it spotlights a 39-year-old lady who's a mother of 2, married, and she was very healthy, no underlying issues, and she got the COVID-19 and was on an extended period of time on the breathing apparatus. And when you're put on those breathing apparatus, you have to be heavily sedated, basically put into a coma. So for her to come out of that because she was underneath it for so long, anyhow, she almost died. So it's and they're beginning to see as we're moving along that it's just not only people with underlying issues and senior citizens. We're also getting our young that are having bad times with this COVID-19. So my personal opinion is we can't completely be hermits in that, but if we practice real good safety, you keep your distance 6 feet away, you wear a mask, you wear gloves, you constantly wash your hands, I think you'd be in good shape. So that's my opinion on it.
Okay, so that's certainly one opinion. I'm just going to wipe down this chair over here. And many things are happening. So we learned that obviously the highest risk individuals is, as you well know, is age. Yes, you can be young. So we know in China, it's around 2% of people admitted to hospital were kids. In Quebec, it's about 5%, if I got the numbers right. I could be off. But many people can still be asymptomatic. So how do you know what group you're going to fit into? This week, I talked to a couple of people who had COVID-19. So one, unfortunately, was or still is an ICU nurse. I spoke to one of her co-workers. She was 52, no medical issues, and she's on a respirator. We have to applaud the people in healthcare still part of this area. Excuse me. And there's another person who's getting over it. She's had it for about 5 to 7 weeks. She has no idea where she got it from. She had no exposures, and she's had it since February is when she feels she got it, and she's been tested positive. But she's on the road to recovery. So you can see it's a whole spectrum. So how to work hard and how to work well. One of the new realities is technology. How do we fit technology into our way of looking at things? So I think, Paul, why don't we, is there any questions or comments by anybody? Any stories people want to make?
And so it seems nothing right now. If anyone does have any questions or comments, feel free to unmute yourself or leave a message in that YouTube chat. It's off to the right there. It's going to say something, so you can type something there and ask any questions for us as well if you have.
Hello.
Yeah.
Excuse me. How do I see you guys? I'm listening. My name is Satinder Vig.
All right, Sonya. Sonya's going to tell you. Go ahead, Sonya.
Sonia, tell me, how do I see you guys? My daughter, she woke up. So how come I can't see anybody?
Are you? Sorry. Before I do ask though, are you called in or are you on a computer?
Oh, I see you now.
Oh, okay.
My daughter fixed it.
Yes.
Okay, but you can't see me, right?
No.
No, that's okay. You don't have to see me. I'm not that good.
See you. We want to see you.
How do you see me? I don't know.
Turn on your camera.
This one?
Yeah.
Okay, you see me?
Now
But I don't see you.
Start my video.
You
Oh,
see,
I see him.
I hear a young voice. There you go. Hey there,
There you
Ben.
I
go.
see
Yeah.
you, Dr. Kanu.
Welcome. You see, so I'm learning all these things, and I think just
Me
playing
too,
around
but
with these
How
things.
come they don't see me?
We
Oh, you can see me, Dr.
I can
Kanu?
see you. I can see
Oh,
you.
boy. Okay, I need a haircut. Okay,
Don't
thank you.
touch remember, you're not supposed to touch your head anymore, right? Well, keep your hands off your face. That's
I thought you're not supposed to touch your face.
I know. Your hair counts.
Okay, that's interesting. I won't interrupt you anymore.
No.
Well, that's okay.
That's fantastic. So, there's we do this on a WebEx. The reason we do on WebEx because Paul knows how to use it, and they don't cut us off after an hour, so we can go on longer.
Yeah.
Where Zoom might cut you off after 40 minutes if you're not careful. So,
Yeah.
but they waive some of those things right now, but that might change. So, it's funny is that people who want to unmute themselves, I want to see your faces. I love seeing people. I miss not having proper contact, but I'm also enjoying this contact. And Paul and I decided until we die, or till you all die too, we're going to do this forever. So I figure I'm good to 100. So if all goes well on my 100th birthday, how are you going to be when I turn 100, Paul?
Let's see. I'm gonna be 60.
60. Then he's going to take over. He'll be the new 60. And so we'll work on that. So I was thinking, you want to show that short clip there?
Yep.
We have a little clip to show you, and Paul, you're going to stop at some point in time, and you're going to have to figure out what to do next, okay?
Right. Sonya, if you could just stop about a minute in. I'll let you know when, but yeah, so hit play. All right, so you can stop it right there.
So the story is you're the car driver. You go by a bus stop. There are 3 people. For us guys or for ladies, it's a significant other, the dream of your life. Your potential soulmate. Second person is someone who saved your life, a good friend. And the third, that's background noise there, Paul. Was that
Yep.
background?
Here, I'm gonna. Yep. Okay.
Okay, Paul's going to fix that there. And the third is a sick lady who needs help. You have 1 seat. What are you going to do? What are the 3 you're going to do? So, does anybody have an answer to that? That's a tough one.
Yeah, it's a tough one. We can wait about 30 seconds because the YouTube is slightly delayed. But if anyone wants to unmute themselves and perhaps
You're gonna give up your seat. Let the old lady and your buddy that saved your life take the car, and you're gonna stay with the lady.
And take the bus with her. Very good.
Wow.
Did you have to see that video before?
No, I haven't.
Fantastic. So,
Wow.
that's why I didn't get it right. Let's play the rest of the thing there. Very good.
Outside the box thinking. Wow.
Let's play that video. Let's go over there.
Oh. Okay. Oops.
I'm inspired. Fantastic. You know, is that I didn't know what to do, and that's the best solution of all. And it reminds me that I've seen some really inspiring people over the last little while, and I've seen some people at their worst as well. And to me, thinking differently, thinking better, and making change. So one of the people I want to applaud right now is, our leader here in Ontario, Doug Ford. He's stepped up to the plate, and he's doing some amazing things. So, and that's a radical change from what I expected from our politicians. And so I think our politicians are doing a great job. We're very privileged to live in Canada, but the problem is this is not going to go away in 2 weeks, 2 months, or 2 years. We have no cure for COVID-19. And I'm going to assume at some point in time, many of us may get it, and we want to be in the best fighting shape possible. So, as I keep saying, is that working together, becoming healthier, and staying connected. So this video is about staying connected, and I want to thank Paul for keeping us connected. I want to thank you all for attending and your participation. And I think that was I forgot who got the answer. I think that was Mike, right? Mike, you got it. I mean, we need each other. So the successes are being able to think clearly and maybe differently, think differently. Let's go to the next picture that we have. All right, this is my son Jordan. So Jordan is 19. Now we're close together. We live together. I guess that's okay. So we're in the household, but he actually lost 60 pounds. He's had a great year at Queen's in engineering. He told his dad a couple years ago, "Dad, I hope you don't mind this. I don't like biology. In fact, I hate biology. It's too much memorization. I love physics and maths." And he's now an engineering student at Kingston and doing phenomenally well. And he just started his first co-op as a second-year engineering, working at a local company here doing an engineering project. So very proud. This is on Saturday. I'm going out on my bike rides, and he goes for his runs. I said, "I'll go for a run with you, Jordan." After 100 yards, I fell behind, and I realized I'm 60 years old. He's 19. Lungs of a 19-year-old are better than the lungs of a 60-year-old. So it reminds me I'm human, I'm mortal, I got to get better. I rode for 100 kilometers last weekend. I'm going to try for another 100 kilometers this weekend, and I need to get myself into better shape. So first, Jordan, thank you for losing the weight. Thank you for being who you are. And thank you for reminding your dad he's 60 and you're 19. And with this 6-year-old boy, I'm going to try to get in the best shape possible. Next picture. Now, you mentioned new ideas. This is the new norm in my office. On the left, you see Jen. Jen is, I call her Sergeant Major at times. She's done so much to keep the office going. She's come up with new ideas. We're getting plexiglass in different areas. We have these masks, we have these shields, and there's Tanya on the other side interviewing a patient. Look. So can anybody guess what's good and what's bad about these two pictures? Any ideas from anybody?
The first,
The first one, yeah, the first one. So you have Jen and one of our workers.
they're too close together.
You're absolutely right. They're too close together. And that's something we have to learn about, right? So we're all going to make mistakes in that. So they're too close together. So even though we're doing all the right things, we're all going to make up mistakes. And we all have to learn about this. So I try to keep my hands down, not on my face. And there's Tamia entering a patient at a distance. And so that's a new norm. And that's what we're going to try to do. Will we always get that right? No, but we'll get better at this. And we're getting back to some new reality. So my new reality is, how do I give you the care, either through virtual care, through phones? We're looking at better technology about that as well through the internet. And how do we still do cardiovascular testing safely? So we start to do this on a limited basis. You get screened. We have a temperature probe. One of the things is I really don't want to measure your blood pressure in the office. I want you to measure your blood pressure at home. You should have a blood pressure machine now. You shouldn't go to Shoppers Drug Mart to use their machines anymore because we don't want to do that anymore, at least at this environment. You should have a scale. My wife says I'm compulsive. I'm weighing myself every day. Today's weight is 174 pounds. I want to be 165, and I'm going to keep weighing myself, keep working on this. So, and remember, you should know what your average blood pressure is. And I know some of us don't have machines, not privileged to have one. If you can get one and measure it. You should know your weight, keep track of it. You should know what medications are going to be running out. You should also make the world a better place because the world needs your help right now. We all need to work together. So I applaud everybody for working at this, and I want you to get your friends, neighbors, enemies, everybody to join us. This is our community. This is our way to dealing with this, and we'll do it better together. Next slide, please. So this is Lily. She has her mask. She's still doing the stress tests. I'm going to try to get Lily to lose a few pounds, and I'm going to try to treat her stress management. But she has the loveliest laugh in the way, and she can make everybody laugh. And we're all working hard together. So this is our new reality at this stage. She says she's smiling underneath that mask. Can you see the smile, everybody? I can see it.
Yeah.
I could see it too.
Thank you, Lily. All right. And how do we open up the world? And how do we keep safe? So you heard Chad saying, young people with no risk factors can still die from this disease. The reality is the people that are going to die, unfortunately, at least in Ontario, are now people in nursing homes. But we want to live our lives safely and effectively, and we're going to explore how we can use computers to do that better. So I'm glad to see as many people join. This will be recorded. Show it to your friends and neighbors. Now, I want you all to think about the webinars on technology. There's two really good ones. One's a simple one. Well, it's not so simple, how to get set up on email, get an email account. The second one I really enjoyed. The first time I watched it was around 11:30 at night time. I fell asleep. I woke up at 4:30 and watched the whole thing and stopped and started a few times. And I'm going to go back and look at that. So we're gonna keep better at this. Next slide, please. And I want to thank Sonya very much she's all the way from Vancouver, and she's communicating to us, most of us in Hamilton, from a distance. So Sonya, a warm hand for Sonya thank you for doing this. Thank you, Sonya. You've done so much already, and you have so much more to do. And thank you. Take it away.
All right. So yeah, my name is Sonya. I am a volunteer at Dr. Kearney's clinic, and I'm a student at McMaster. And basically, in this webinar today, we'll be starting off and introducing a couple of tips and tricks with technology. So we'll start off by talking about technology's role in our health, just in general, and then we'll go on to look at some video conferencing tips and tricks and explore a little bit on the clinic website. And we'll end off by introducing how to download apps into your phone and just a couple of general health applications. So what role does technology play in our health? Technology is around us everywhere nowadays, from our phones that are always in our pockets to, even computers at the hospital, or even technology we see in grocery stores. So it's a really big, rapidly increasing field. And when people see technology and health, sometimes they're not sure what the connection between the two is. But in fact, there is a really big connection, and the connection is really important. And it's even more important in times like this that we realize that connection and we start to use technology to its best advantage. So we'll explore that a bit today. So the first reason that technology can play a role in our health is by enhancing our social networks. And essentially, through technology, you're able to stay more connected to your family and your loved ones. So a lot of studies in recent years have actually shown that when individuals use technology to stay connected, there's often decreased isolation and feelings of loneliness, and it can also reduce depression as well. And I think this point here is really important to highlight nowadays when we might not be able to see our friends or our family or our colleagues the same way as we normally would in person. That's when technology comes in by using FaceTime or by sharing pictures and stories on social media. You're still able to feel as though you have that support system with you and you're still able to stay connected. So that's how it is able to then increase your overall well-being and your life satisfaction as well. The second way that technology can play a role in our health is by facilitating our healthcare goals. So if you think about it, when you go to get your blood work done, all those results are sent to us in the clinic, but you're actually able to access those results online as well. And you're able to access a lot of other health reports that you have online. So using technology, learning how to use those features and platforms can allow you to stay more informed on your health status and your progress. And the second way is through phone applications and a lot of online blogs and different tutorials on the internet that can actually allow you to support you in your goals and again allow you to keep track of your progress. So facilitating healthcare goals is probably the second way that technology can play a role. Now, before I get into all the nitty-gritty details of the little technology in video conferencing and the website, I want to stop you for a second and ask you what mindset you're going to have when you're going into this. So oftentimes when I talk to individuals about technology, I often hear phrases like, oh, you know, I'm too old to learn about technology, or yeah, I've tried it, but it just didn't work, and I don't think I can do it again. I think this image here does a really good job of showing two types of mindsets that you can have, not just when you're going and forward and learning about technology, but really anything in life. You can either have a fixed mindset, which is, you know, you give up when you're frustrated and you kind of think that your failure is essentially the limit of your abilities. Technology has many challenges. It's not easy to learn, and you will face obstacles, but you can enter it with this fixed mindset and have your growth be limited, or you can enter it with a growth mindset, which is shown on the left here. So in a growth mindset, you're looking at more about how you can use that failure and those obstacles as an opportunity to grow. So you see those obstacles not really as barriers, but as learning opportunities, and you're able to sort of integrate feedback and apply it to grow. So I urge you as we go on in this technology journey to have more of a growth mindset rather than a fixed one. So we'll start off first with some video conferencing tips. And I just want to share this video here that was actually sent by one of our patients to highlight the importance of learning how to do video calls.
COVID-19 is causing hardships for many people, especially those isolated in long-term care facilities with no visitors at all. But one downtown center is helping seniors use new technology for the first time in their lives. Here's CTV's Pauline Chan.
7, 8.
92-year-old Fred Hill is doing his exercises with his daughter Joanne in Niagara. She used to visit him at the Rec-Eye Center on Wellesley Street once a week, but since the isolation measures for COVID-19 were brought in, he's actually been seeing her every day.
Our FaceTime initiative started actually a couple of years ago with Sherburne Place. We had a couple of families there who lived overseas and were unable to come in frequently, so they asked us to set up FaceTime with their family members.
But Hill had never experienced FaceTime in his life.
So what do you think of the system, Fred?
I think it's a great system. It looks enormous, I think.
It's going to be lovely.
So far, Rec-Eye Center staff have been able to facilitate FaceTime and Skype calls for more than 40 families, many daily.
We didn't expect the overwhelming response from families. So getting the chunk of time per day set aside for families has been probably our biggest challenge so far.
Hill's message to his family and others is the same as most of us.
Well, be careful because of this virus, and I hope they're all well, and God bless them.
Hill says Joanne and her husband are his favorite people to talk to, so he's thrilled that the new technology is allowing them to stay in touch and stay safe.
Well, I've been very lonely if I couldn't talk to my family.
Pauline Chan, CTV News.
So as you can see in the video, I think this example of Mr. Hill is a really great way to show how technology is able to help you stay connected to your loved ones. So Mr. Hill is able to do his exercises with his family in his home, and also how it can facilitate healthcare goals. So he's still able to continue his exercises and continue his lifestyle of being active. So really great example, and we can all learn from it how important things like video conferencing and video calls can become, especially now.
So the screen has stopped sharing, so you might want to reshare that.
Okay.
While they're doing that, I'm just having some little salad, some beans, just lots of different vegetables.
Are we good now?
You good?
Okay, great. So the first platform I wanted to go over was WebEx, which a lot of you are on right now. And if you're joining from YouTube, you can also use this as an opportunity to learn more about it. And so maybe you want to join us next time on WebEx instead of the live stream. So WebEx is a video conferencing platform. Essentially, WebEx allows for two-way communication, as those of you who are on it right now will be able to know. So essentially in WebEx, you're able to have a conversation. It's similar to FaceTime. So we'll go over how to download WebEx first. So essentially to start off the download, you would first go onto this website called webex.com. And then this is actually a clip from the technology workshop video, but I'll only play the part that shows the screenplay of how to actually download it. Simply click the link for the WebEx, and you'll see this page pop up here. So it'll say starting Cisco WebEx meetings.
So as we get that there, so what I'm having for dinner, I'm having coffee with just a little bit of almond milk and just salad with beans left over from lunch. Onions and tomatoes, fire away. Is it working?
In order to access WebEx now, if you don't
I get to share your screen, right?
downloaded,
We have a picture of yourself right now, which is wonderful.
I see the screen shared right now. On YouTube as well, it seems to be good.
So what we're getting here on WebEx just as a picture of you guys.
Okay. I'll say maybe try leaving and rejoining, Dr. Kearney, if you're only seeing a picture of us.
So I just have to leave right here.
Yeah, just press the X and then open up the same link that I sent you.
Leave.
I'm on WebEx and I can see the screen share.
Okay, perfect.
Okay. Yeah, that's one of the difficulties with technology is sometimes it bugs out, right? But
yeah.
it's a good learning opportunity, like we said.
Yeah, so again with WebEx, you're going to click this link to download it, and then usually with WebEx, when you're joining it, you would have to join a link, as Dr. Kearney is probably doing right now, and then this video will show you how to download it into your laptop or computer if you don't already have. So I'll just start it over here.
Yeah. So all of you that are watching on YouTube right now, you can try this out next time in the newsletters and on our website, drkearney.com. We have the YouTube link. We have the YouTube link as well as the WebEx link. And so You just have to click the other link and try downloading that. Sonya's going to show how that works.
Simply click the link for the WebEx, and you'll see this page pop up here. So it'll say starting Cisco WebEx meetings, Friday nights with Dr. Kernew with the date and the time. And in order to access WebEx now, if you don't already have WebEx downloaded on your laptop, you can hit this button here. It says, don't have the desktop app, download it now. So this is if you don't have WebEx already on your computer. So if you would like to learn how to download it, we're going to hit download here. And you'll notice a little window pop up on the bottom left-hand corner, which essentially says, click here to install WebEx. And you can go ahead and click on this little tab. And you'll see here that WebEx is essentially downloading into your laptop. So this is going to install the app into your laptop. Once you have WebEx installed into your computer, a similar screen like this will pop up in the middle of your screen. And so essentially, here you'll notice the workshop titles. So in the case of the webinars,
So yeah, we're getting a little bit of feedback here. Do we need to?
Nights with
we're getting a little feedback a little bit.
Yeah, a little bit of echoing. Are you using headphones, Sonya?
No, I'm not. Is it better now when I just talk and without the video?
Yeah, it's okay without the video. It seems that the video and our voices might be echoing back as well, or might be a little bit loud.
Okay, well I can explain this part just by voice once my screen is up. So essentially, that as you saw, once you download WebEx into your computer, you'll notice a small tab pop up here. And essentially what you can do is this is what will show up before you've entered the meeting. So when this pops up, you're not in the meeting just yet. You'll notice 3 icons here at the bottom. So there's 2 red ones and 1 big green one that says start meeting. So the red icon, these 2 are for your audio and video connection. So we'll go over that in just a second on what exactly they mean. But they essentially control whether your microphone is on or off and whether you want to enter the video or enter the meeting with your camera on or with it off. And once you have made those particular selections, you can go ahead and hit the green button that says start meeting. If you're a host of the meeting, it'll say start meeting, but if you're joining as a participant, it will most likely say join meeting. So that's just something to keep in mind. And once you hit that, you'll essentially be in the meeting. So this is again showing the similar screenshot. So you'll notice here at the bottom, it also says use computer for audio. So you can choose whether you want to use your computer and have audio played from there, or as you'll see on the second screenshot here, there's also other options where you can actually have WebEx call you on your phone, or you can call in on your phone alone as well. So by calling in, so if you hit call me, WebEx will essentially call you on your phone and you can sort of enter the meeting in an audio way and you can't share your camera. And if you click call in, you will essentially get a number pop up and you can enter the meeting that way. So those are options if you wanted to use your telephone as audio rather than your computer. So once you are in the interface, you've entered the meeting, this is kind of what the platform looks like. So for someone who's new entering this, there's a lot of different icons, a lot of different buttons, and how do we figure out what all of this is? So I'll take you through the main icons and the main areas that you should be paying attention to. So right in the middle where you see my initials SG over here, this is essentially where you would have the main presenter info. So right now, for those of you who are on WebEx, this is where you see my slides, and currently you also probably see all the different individuals' faces who are joining us today as well. So that's where presenter info goes or where video is displayed. On the right-hand panel, you'll see all the list of participants. So in the case of my screenshot, it was just me, but in this webinar here, you'd probably see a list of all the participants that are joining. And the bottom icons here. There's a few additional icons that will help you navigate whether you want your microphone on or off, your camera, and a couple other features, which we'll go over now as well. So a lot of these icons are actually used in a lot of different other platforms as well. So it's kind of a good idea to get a handle of what these icons really stand for. And you'll notice that they're very similar if you're using other platforms or you're using your phone for FaceTime as well. So you'll notice here the first icon is for the microphone. So essentially, when you click this microphone icon, if it is gray, that means your microphone is on. So you're unmuted and you're able to talk. If it is red, that means your microphone is off. Note that the icon can also be gray and just have a line across it, so it doesn't always have to be red. But in the case of WebEx, if it's red, your microphone is off and you're muted, so nobody can hear you. The two that are underneath the microphone icons are the video icons. So when your video is on, it will most likely be blue or simply filled in. So that means your webcam is active and everyone is able to see your face. And usually on video conferencing platforms, you can sort of see a small window with your face as well, so you can kind of see what you look like in the moment. And underneath it, if there's a line across that video icon, or if the video icon is shaded in gray, your video is off. Now, a really important feature of a lot of these video conferencing platforms is the chat feature. So usually it'll be shown by this little chat box here. And I'm just going to go back one slide to show you where that is on the WebEx interface. So you can see the little chat icon on the bottom there. And essentially, when you click on that chat icon, you'll notice a little box pop up under the participants panel. So we're on the right side of the screen, this little chat icon here. And in the chat box, you're able to enter in your chat message. So for example, I've entered in hi and I pressed enter. And now all the participants in the meeting are able to see my message. So this is really an important feature if you, for example, are not wanting to unmute yourself and ask the question in person. You're more than welcome in our webinars to ask questions through this chat feature. And there's a similar sort of box on YouTube as well. So this is really important to keep in mind that that is available for you too. There you go. Dr. Kearney says, hello all. So the next icon I want to take you through is just the big red X that you see in a lot of video conferencing platforms, and that is just simply to end or leave the meeting. So that is essentially how you enter a WebEx meeting as a participant and some of the main important icons. I also just wanted to go over how to host your own meeting as well, in case you wanted to host it for work or just as a gathering with your family and friends.
Yeah, that's amazing.
So when you enter in webex.com, this is the main homepage of WebEx, and you'll see on the top right-hand corner, we've got a little symbol here that says host. So you can go ahead and click that. And essentially to host meetings, you actually do require a WebEx account. So normally to enter meetings as a participant, WebEx doesn't normally require you to make an account. Anyone can sort of enter in as long as you have the meeting URL from the host. But to host a meeting, you will need to make an account. So if you already have a WebEx account, you can go ahead and enter your email address. And following that, it will take you to a page where you can enter your password. If you don't have a WebEx account currently, you can hit the small blue text underneath that says sign up, and it'll essentially allow you to create an account with your email address and create a password. So once you have created an account, this is the interface you will see. So again, different icons, different tabs, but we'll go over the important ones. On the left-hand panel, you've got home, meetings, recordings, preferences, etc. So this is what the home page looks like. So right away, you'll see you can start a meeting right there in the moment if you would like, and that will essentially produce a URL that you can share with your family and friends, or you can schedule a meeting, which is the gray button beside it. So again, start a meeting, you're starting it in the moment, whereas schedule a meeting, you're scheduling it for a future date. So let's say you decided to start a meeting right there in the moment. You want all your family and friends to join you. Again, this is we enter again our familiar WebEx interface with a lot of the main icons on the bottom. And essentially to invite your family and friends, you would hit the 3 dots here. So there's an icon beside the end meeting button with 3 dots. And it says invite and remind. So once you hit invite and remind, you'll be able to enter in the email addresses for your family and friends, and then they will receive the URL link to join the meeting. On the other hand, if you wanted to schedule a meeting for a future date, you would hit that gray button that says schedule, and you'll notice this sort of interface pop up. So in order to schedule a meeting, you can enter in your meeting topic. So for those of you that join us weekly on WebEx, you'll notice it's usually Friday nights with Dr. Kernew, and you can enter in your, it'll automatically generate a meeting password for you. And here under date and time, when you click the small arrow here, you'll be able to change the date and how long you want your meeting for. And this last section here is for attendees. So here's where you can enter in their email addresses, and they'll receive a link to join your meeting, and they'll receive the date, the time, the topic as well, along with the password. So that's really useful if you wanted to schedule it for a future date. So once you've scheduled a meeting for a future date, you'll notice here that when you go back to your home page, you'll see your upcoming meetings. So you'll notice them here. And whenever you're ready to start the meeting, you can hit start. So you'll see here, for example, this person has scheduled it for the future, and whenever they're ready, they can go ahead and hit start, and all their attendees can join. So we'll go on to Zoom. Zoom is a very, very similar platform to WebEx. A lot of the times, if individuals have used WebEx before, they can kind of easily translate those skills into Zoom, especially with the icons. So that's why I'm saying the icons are pretty much everywhere you go. So it's a good idea to get a good hang of them. So to use Zoom, you would go onto this link. So you can just go onto that. And this is the main home page that you will see when you go onto Zoom. So to join a meeting, again, you'll notice similar to WebEx, we've got these little icons at the top here. So you can click join a meeting. And you'll notice that you will need a meeting ID. So it'll ask you for the meeting ID. And usually when it asks you for the meeting ID, if you were already invited to a Zoom meeting, you would have gotten a meeting ID in the email along with the URL link. So when it asks you for the meeting ID, you can simply go ahead and copy this meeting ID into this box over here and hit join. Alternatively, you can also just go into your email directly and click the link, which will then open up the Zoom interface as well. So in the case that you click the link and open up the Zoom interface, you'll notice this sort of page pop up. So it'll say launching, and there's two things here. So if you already have Zoom installed into your computer, as I did when I was screenshotting this, it'll say open Zoom at the very top, in which case you can go ahead and click open Zoom, and your Zoom app on your computer will automatically open. In the case that you don't have Zoom already installed, we're going to hit this small blue text here that says download and run Zoom. And the process in which Zoom downloads is pretty much identical to the process in which WebEx downloaded. So if you recall from the previous screen sharing, when we hit download, we had a small icon pop up on the bottom left-hand corner, in which case, once you click that, it would essentially install the app into your computer. So pretty much identical process for Zoom as well. Once you have opened up the app, whether you download it or you already have it installed, you can click join with computer audio if you would like here. So again, similar options you can enter in whether you would like to enter muted or unmuted, camera on or camera off. And this is what the Zoom interface looks like. So again, notice how similar it is to WebEx, right? So you have your participant panels again on your right-hand side. We've got a group chat box on the right-hand side under the participant panel. In the middle here, we've got the slides, so whatever the slides the person is sharing. And the bottom here are the icons that we talked about earlier. So we've got the microphone icon. So in this case, the person is muted because the red line is across it. We've got the video icon. So again, in this case, the person's video is off because the red line is across it. And we've got the chat box and a couple other icons there. And instead of the big red X, instead we have here leave meeting. So that's essentially how you would exit the meeting. So again, if you start to become familiar with these icons and sort of how the general interface looks like for a lot of video conferencing platforms, you'll start to notice a lot of the similarities and you can translate some of those skills. Again, quickly going over how to host a meeting. Instead of clicking join meeting, you would click host a meeting here. In which case, essentially, Zoom would allow you to go through the same process as WebEx in creating an account and to send you a meeting ID. So before we move on, are there any questions about WebEx or Zoom or any other issues people have been having lately with video conferencing?
Sonia, I have one question. Can you hear me?
Yep.
Is there any cost to these platforms?
So WebEx is free and Zoom, so WebEx is free with the unlimited amount of duration, and Zoom right now is free for only 40 minutes. That's the kind of cap they've put on for free participants, I believe. Right now, they are sometimes a little bit lenient given the current situation. So the other day I was having a Zoom call. It was the first time that one of my friends was using it, and it actually let you go longer than 40 minutes. So it just depends on sometimes if it's your lucky day, it'll let you go longer. But Zoom is the one that does have the time cap.
And what's the difference between Zoom and WebEx? Why would you pick one or the other?
So I personally would go with WebEx because of that time cap. I think WebEx, you don't have to stress about it kicking you out after 40 minutes, which is nice. In terms of the different features they have, I would say they're essentially very, very similar. I wouldn't say there's a benefit to doing one over the other. For example, both of them allow you to share content if you're doing a presentation. Both of them have the chat feature, and yeah, I think they're very similar in terms of features. So the only reason I would choose WebEx over Zoom is probably because of the time cap.
And Paul, do you have a preference, and what other platforms are available? And if a person doesn't have an email address, can they join or not?
Right. So I again prefer WebEx just because we don't have to worry about the time cap. But for those who are looking for some other platforms, if anyone has an iPhone, and if you know anyone else in your family that has an iPhone, there's a very simple thing that you can do called FaceTime. So everyone has this option on their home screen, and the icon looks like this small little green square there with the video icon. So if you open that up, you can choose any of your contacts as long as they have another iPhone, and you can give them a video call as well. So it's super simple. It's maybe 1 or 2 clicks away, and it connects.
Well, that's not for people like me, but we can do it. We're learning.
Yeah, and like Sonya mentioned earlier, I think perhaps the most important thing is understanding that this isn't gonna happen overnight. It's a process of repetition and repeating things over and over and over again and trying again. That ingrains it into your head.
So Paul, you gave me a little bit of feedback again.
Yeah, I think that might actually coming from Sonya once more. She doesn't seem to have headphones, but and that's okay. It doesn't seem too
Yeah,
bad.
no, it's not bad at all.
Yeah.
Anything else? On any other platforms besides WebEx and Zoom? What else is out there?
Yeah, so another platform that I think a lot of individuals use is also Skype. So that's another popular one used both by professionals as well as with family and friends. So we are not going over Skype in today's webinar, but there is actually the second technology workshop video goes over it in very much detail.
Yeah.
So process of how to download it, and you'll notice again a lot of the icons are similar, but it's again a really great app. It's also free. There's no time cap, so that's really nice as well.
Thank you. Anybody else have any questions? Any comments from anybody else at all? Or this is fantastic. So
I do.
Yeah, please.
Hi, Doc. Sonya, I love your presentation. It's amazing. I do have a question, though, a comment actually about Zoom. My choir has been using Zoom. We started using Zoom when this lockdown first started for our choir practices, believe it or not. And we quickly stopped when we learned that there was some sort of privacy issue that actually it was in the media as well. So I don't know if you've heard whether that's been resolved or not by Zoom.
Yeah, there definitely have been a couple of cases recently where, because individuals are using a lot of these video conferencing platforms nowadays, there's Zoom meetings happening around the clock every day. And so sometimes there are privacy issues where individuals might be able to sort of enter in your meeting without your permission. That can happen, if they acquire the URL link and they weren't meant to. And so those issues have been coming up lately. I'm not sure that Zoom has completely resolved them. Personally, in my experiences of using Zoom, I haven't been acquiring any of those issues, but if that does happen to you, there are ways that you can report those issues to Zoom and have them look into that directly. And I think it just highlights, again, one of the, I guess, downfalls of technology and internet in general is that our information is essentially very much public once we are enrolled in it, once we download any apps or have email addresses or are on these platforms online. So it's definitely important to. Pardon?
I just told Mike to stop scratching his head. We're helping each other out there about hands.
Yeah. So I think it's actually a really important idea to even read the privacy terms of any sort of platform before you go on and log on and decide to use it, just so you kind of know what information they are able to get a hold of and what the process is if those issues do occur. So great comment.
Also, I'm just going to add on there as well. I think I know what you're actually talking about, in that I received an email from McMaster saying that there was a breach of Zoom security and some of the passwords, or some people did have access to some of the passwords. So if that's the incident that you're talking about, it took place a couple of weeks ago. I would just recommend that you get everyone in your choir to just change their account password, and that should help with most of it, because if someone this goes with most technology, if someone does have access to your password, then if you change your password, they shouldn't be able to log in with your old password as well. So that could just be done from the Zoom website, and you just log into your account and go to settings and change your password. But like Sonya mentioned, it's really important. Like, there is some issues where some people are able to join some rooms that they might not necessarily belong in. So we would also recommend, you'll notice when you are hosting your own room, there's an option to add a password. So would recommend adding a password to all your rooms as well. Whether your password might be the name of your choir, so everyone who's entering your room has to put the name of the choir. For us, we use the password of Kernew as well. So if anyone entering, if they're asked for a password, they enter Kernew. So you can put passwords on the rooms as well to make those more secure.
Yeah, hello, Paul. Hello.
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 Did you have a question?
Yeah.
Oh. Go ahead.
You talking to me, Dr. Kernew?
Anybody else have a question or comment?
Yeah,
I had a comment, Dr. Kernew. I was going to ask Paul, is it easier if you have like 6-7 people and be on FaceTime?
Yeah, so group FaceTime is something that Apple added recently, where you can FaceTime multiple people. I would say once it gets to that amount of people, I personally find it easier to use Zoom or WebEx. Unless you already have a group chat created, then it's just the same way. You just have to hit the same 2 buttons if you have a group chat already made on your phone. But for most people, it's probably easier to use what Sonya is saying here, Zoom or WebEx.
What about you, Sonya? What do you feel about that?
Yeah, I think I've used FaceTime in groups before. Sometimes what happens is that when you have a lot of individuals on FaceTime too, the quality of each picture sort of goes down, I've noticed. So again, like Paul's saying, Zoom, WebEx, even Skype, I would say, is really, they're they're bigger platforms that are sort of able to handle more people. So I would recommend, if you can, to get familiar with those. And I think they're great tools to use, even if you want to incorporate it in work or other aspects of your life as well. So.
And I think is that WebEx has better security than Zoom at this stage. Is that a fair thing to say, or not? That's your concern. I think anything I say on the internet, anything, in fact, anything I say, everybody seems to know before I say it as well. So I guess
not true. We are all learning. Well, you may know more than anybody, but we are all learning. I had just one more comment on Sonia's detailed presentation, which was very educational. The easiest way to get on WebEx with Dr. Curnew is just because he sends an email. Just click on that WebEx site and bingo, you are right there. You don't have to go through all the rigmarole. That's what I do, and I have no issue.
Thank you. That's thanks to these guys. It's not me that does it.
Well, thanks to you that you send the email.
Thank you. It's a team approach. What I'm saying is that, we're thinking outside the box, how to do things differently. Let's take it from there. What's the next part, Sonia?
Sure. So next we'll be going over a little tutorial on our clinic website. So if you don't already know, our website is drcurnew.com, and essentially we have a lot of great resources on this website here that I'll be taking you through as well. So do I see the website right now?
Yes, please. Yeah.
Perfect. Okay, so this is essentially the home page of the website, and I'll help you navigate through some of the main sort of features of it. So again, it's www.drcurnew.com, and when you log on, or not log on, but when you enter in that address, you'll essentially reach the home page. So this is what the home page looks like. And I want to first start off by going through some of the key features of websites in general, which I'll demonstrate through here. So you'll notice the top left-hand corner is the logo. So I want to highlight that in websites, whenever you are moving around in different tabs and entering different pages, usually when you hit the logo of the website, it'll return you to the home page. So I think that's a really important tool to know. So for example, if I'm clicking on Dr. Curnew's blog here, it'll take me to a different page. Just loading here.
Eat your fruits and vegetables.
So essentially, it'll take you to a different page. It's just loading, but when you hit the logo here, it'll return back to the home page as well. So you can see that here.
So you mentioned that you can see the links to the blogs there to what we're on right now. You see, so you can.
I have a question for you, Dr. Curnew. Are you going to have those baskets of vegetables and fruit available again this year?
It's a great question. So the Good Food Box program, something that's run by the city of Hamilton, where you get these boxes of vegetables, great fruits and vegetables at a discounted rate. I'm not sure what's going to happen right now. I think that's on hold. But one of the things that we're going to have to talk about is, I think we're going to have to talk about getting a garden for all of us. So we're going to actually spend a webinar in the future about how you grow your own vegetables and fruit from your balcony to your own garden. So I think we're going to complement that. What I remember during the war years, that I remember correctly, about 40% of people's fruits and vegetables are actually grown by people, and so growing and gardening is a way to help relax. So the Good Food Box program is certainly not operational yet. It will be at some point in time, but we're going to innovate and become our own gardeners soon. And
yeah, my wife does that, and she puts tomato plant, and one plant gives you, like, it probably costs $25 for one bloody plant.
That's okay. You're okay. Good.
I'd rather get your basket.
All right, that's one solution. Different strokes for different folks. Go ahead, Sonia.
Yeah, so again, clicking the logo will get you back to the home page. Now, there's a couple of important things to know on the home page here alone. So you can sort of see as you scroll down, you'll be able to see some of the future dates and when the future webinars are happening. So here under current news and health, you can see some of the past webinars we've hosted, and clicking on them will allow you to, again, go back to the pages of those webinars and the link, which I'll show you in just a second. If you continue scrolling down, you'll actually see a little calendar here. Now, if we go back a little bit, you'll notice that, for example, in the month of April, we actually have a schedule of when the webinars happen. So you'll notice Friday night, 7 p.m., and clicking on it will also show you the topic of those webinars. So it's a really great tool for you to see some of the upcoming webinars that are going on, or some of the workshops that are happening once we're all back in the clinic as well. And again, you can see the date, the time, and you can even copy it to your Google Calendar if that's something that you use as well. So that's another useful tool. And going down just below the calendar, we have a list of workshops that happen at the clinic. So again, this was when the workshops happen in person, but essentially when you click sign up here, it'll open up a different page where you can actually enter in your name and your number and your email, and then sort of sign up for that, for whatever workshop you would like. So another really important tool to know as well. Just loading up here. So here you can see different ways that you can sign up for the event. So you can choose whether you would like to sign up for the workshop or the other activities that are going on in the clinic. And if we continue scrolling down even more on the home page, you'll end up with this little gray box here. And essentially, this is a way where you can subscribe to our monthly newsletters. So you'll be able to enter in your email address here. And as soon as you hit this gray button, subscribe, you'll be able to get the notifications from our clinic. So those include the monthly newsletters, as well as whenever webinars are happening, that's where you'll be able to receive the link to those webinars, whether it's through WebEx or through YouTube. And just this really great way to stay connected again and to get all those updates right to your mailbox. If you are thinking right now that, well, I don't have an email address, or I'm unsure of what my password is, again, I encourage you to watch the first technology workshop video on YouTube, which takes you through how to create an email, and you can subscribe then as well. So as you can see at the top here, there's a couple of different tabs that I wanted to go through. So we've got Dr. Kearney's blog, which is the first one. We have an about page. And an important thing to note about tabs on a website is actually when you hover over sometimes on tabs, it'll show you even more tabs in the drop-down menu. And hovering on those will show you even more options. So it's really important that you sort of, when you're looking at tabs, not just on this website, but in any website in general, that you sort of hover over them to see that you're not missing any sort of options. So again, you see the drop-down menus. So we'll start off by looking at Dr. Kearney's blog here.
It always takes, we have to have some patience as it opens, and this is the work of so many people, and I'm very grateful for everybody's participation. So I hope everybody's thinking about planting a garden. Let's see what we got here, Sonya.
Yeah, so opening up Dr. Kearney's blog, essentially you can see that there's several different posts. So for example, last week there's a post here again. This is where we are also posting the links to the webinars, as well as the link to the YouTube live stream. So this was the last webinar that happened last week on understanding scientific research. So if you aren't subscribed to our emails currently, you can also actually access the links directly on the website here, which is, again, another great way to join in every week on what we're doing. So scrolling down, you'll see we've got the 6-minute walk, which was discussed a couple weeks ago on our workshop on healthy living. And again, a lot of different webinars and stuff that are happening. And even if you missed a previous webinar, this is a good place to go if you want to sort of catch up on these topics or access the recordings that we have on YouTube. So those are some of the posts there. The About page will just sort of show you the clinic's address and the phone number and how to contact us. I wanted to go over Patient Corner here. So under Patient Corner, you'll notice a tab that says Health Articles. And so there's more So again, hovering over these titles will open up a lot more options. So we've got taboo, medications, risk factors. So for example, these health articles are really great resources if you want to stay more informed on a particular topic. So if we're under medications here, we can, let's say we want to learn about the ABCs and medications. So we can click on that. And again, just loading here, but it'll pop up the article on medications. And it's a really great way for you to learn what the team at the clinic has to say about these variety of topics. So here's what the page looks like. We hit patient corner, health articles, and in this example, we went on to medications and the ABCs of medications. So there's a couple of different tips and tricks here as well. So we've got a variety of different topics, and we're working on sort of updating these as well as we move further. So it's a really great way to check those out as well. And under community corner and special events, you'll be able to see again the workshops. So if I go under special events and under workshops, again, just loading here, but you'll be able to see the different workshops that we have at the clinic. So there's a variety of different topics that we discuss, everything from sugar club to congestive heart failure, and now technology. But these workshops are a great way for you to stay involved and more informed about your health. So you can see some of the options here. And again, clicking on these, when you click sign up here, it'll take you back to this page where you can enter in your information and stay informed that way. And just some other things I want to highlight in the top left-hand corner. Again, common with a lot of websites, you'll see what their social media platforms are. So this is the Facebook icon. The second one is the Twitter icon. And then we've got email as well as LinkedIn. So if you hit on the Facebook icon, it'll actually take you to the Facebook page. And in the Facebook page, you'll be able to see Dr. Kernew's Life Group. So again, it's a really great way for you to stay connected here through Facebook as well. And so taking you back again with Twitter, that's the second icon, and that'll take you to Dr. Kernew's Twitter account as well. So again, as we get more familiar with technology, it's really important to check out these social media platforms as well to stay connected.
So if you want to find what webinars or what's available, is it better using Facebook, Twitter, YouTube, the website? It makes it hard for me to decide what to sign up and not to sign up for. How do you decide? How do you sign up for? I want to get some, make sure I don't miss something.
I would say the best way to, if you are afraid of sort of missing anything, I think the best way is to actually sign up for the monthly newsletter. So that way you're getting notified right to your email whenever there is a webinar happening or whenever there's a new event. So that's probably the best way to stay notified. But again, there are a variety of different options. So if you are someone who likes to use Facebook more and you're very active on Facebook, again, clicking the link to join, like the Dr. Kernew page, we'll be posting the webinar links there as well. And if you're unfamiliar with social media, we'll be discussing it further in the future, so stay tuned to that. But you can also go under the blog. So lots of different options, but I think the easiest way, the most accessible way would be to sort of subscribe to the newsletter to be directly notified.
What's your thoughts, Paul?
Yeah, I would say the newsletter is, like Sonya said, the best way because it goes straight to your email. The website is typically reliable as well because you can see a history of the things that we post to, which is nice. We do, however, try our best to post it in as many places as we can, just so we can hit everyone's cup of tea as well. If you're looking for something reliable, I would recommend the newsletter.
Does anyone have any other questions on the website at all?
You got to play. You got to try different things. I didn't these buttons, and don't be afraid. You can't break the website.
Dr. Kearney, are we still having workshops, or this is the workshop?
For now, is that because we have to be this distancing right now, this is what it is right now. And so I think we're going to have, as time goes on, I don't know how that's going to look in the future. As you saw that first video about the gentleman who got the girl of his dreams and saved 2 people, we're gonna learn as we go. So I'm first of all very proud that we're able to offer this, and I'm only grateful because we're doing it as a team. We're now having people come to the clinic in a limited way. I'm used to having a busy busy waiting room. My exam room or my waiting room is empty. There may be 1, maybe 2 people there, and that's different. And now we're moving to this online platform, and I never thought I heard the word Zoom before. I didn't know what it meant. I thought WebEx was a sort of like a biscuit or something, but so I'm learning, and how it's going to transform, I don't know. And I just found out that I tried a little bit of video conferencing. That didn't work the first time, but it's going to work the second or the third time. So stay tuned. I don't know the answer to that right now. It's going to change.
I used to think Zoom meant you enlarge the picture.
Good point.
Yeah, but Dr. Kernew, you have a good team, as you said, but the team has a good leader. So thank you.
You're very kind, but I think you're only as good as the people around you, and I'm blessed with so many wonderful people and so many wonderful patients. One of the things I'm going to ask everybody to do is that when you get it, your appointments right now are going to be by a phone call by myself and some of my teams. Sonya, for instance, is going to call you from BC, same as Rachel. So you might get a number from BC. Some people think I'm a used car salesman trying to sell you anything. I want to sell you health and be healthier and stay connected. And for us to work to do this is that we need to work together. So be open to suggestions. Sonia's, are you a fixed thinker or are you a flexible thinker? I think we're all learning flexibility at this point in time and staying connected. And you're going to have different opinions. And I will say this is that I rely a lot on experts to give me advice. I have to digest the information. There's so much that's changing. So stay tuned and we'll stay connected. And we need to learn, and we need to unlearn and relearn and keep moving forward. Sonia, what else can you tell us? Any other questions for anybody? And one of the things I'll tell you one little story was that when I got back and I was in quarantine, the first day I just sort of sat in my house. I did 3,000 steps pacing. I made a bunch of phone calls online. And then my wife said, "Get outside, you bum." And I went outside. And since then I picked up biking. And biking, I've always enjoyed, but now I go out there and I go for a ride between 20 to 50 kilometers. I can go in pitch black, dark, somewhere in the middle of nowhere in the woods somewhere. And I call people and I stay very connected. And you might get some wind there. I see there's Joanne and Phil there, so they get many phone calls. There's John that I gave many phone calls to, and to many of my students. And actually, I don't like calling my brother and sister because they complain about the wind noise. That's just part of cycling. There's wind noise. It's good. So we get good connections and bad. There's Chad behind me there. I call him. We're supposed to do some forks over knives an hour ago, but I'm a little bit late. If you're on the schedule, I'm going to try to call you, but I'm not going to be on time. I haven't been on time in 60 years. I'm even worse now because there's so many emergencies. Yesterday, I talked to 2 people with COVID-19. I had to organize an angiogram in this situation pretty rapidly. I had someone who had chest pain that I had to bring in to look at, do some tests. There's another gentleman who has end-stage heart failure who's not doing well. I need to be available, and I need you to all understand that. If you want somebody who's on time, don't see me. If you want somebody who's going to try to do my damnedest to help you, I'll do the best I can. But don't expect me to be perfect. You will get my raw emotions at times. I'm half Hungarian, half Newfie, and a bunch of other things all mixed together. And I'll tell you what I think in no uncertain terms most of the time, maybe too harshly. I don't mean to be that way, but I do care. I want the best for you, but I don't want the expectation. So I had one person said, I kept her waiting for 5 hours. I ruined her day. I'm sorry for ruining her day. But I wasn't out playing. I was working and trying my best. And there's lots to do, and there's a lot more sicker people out there, and I just wanted the best for everybody. So let's just work together and let's find solutions. And if that's okay, that's okay. We got to work together. And if everybody took the attitude is how we make each us a little bit better, then we're better off. Enough preaching. I want to hear more about that. What you have to say. And what you have to say. Any other questions, comments for anybody?
Now, Dr. Kudnew, that's very well said. I was supposed to see you yesterday at 3:30, and you got a chance to call me at 7, which was perfect. We are at home anyway. So what are we bitching about?
Thank you. And by the way, in the I want everybody to go to look at Sonia's webinar on the workshop about technology, the second workshop. I have to stop, start, rewind it a few times. It's fantastic. It's wonderful. And there's a good part. There's Joanne and reading to her kids on Facebook. You can do such amazing things. And there's many times where my computer gets stuck, whatever. I call these young people. I've woken up people at 2:00 in the morning. Well, yeah, I did actually. I got stuck and people unstuck me. So just work together. And if you want some help, we will give you some help as best we can. And Sonya at the end will tell you how we can do that. Next, please. Anything else? Go ahead, Sonya. I'll be quiet for a little bit. I talk too much. I apologize.
I got to go. Family's waiting for supper. So I want to thank you, Paul, and Sonia, and Dr. Kudnew.
And thank you for tuning in.
Hopefully we'll see you again soon.
We'll
and
see
I'll get on that.
Every Friday, 7:00 till next 40 years, okay?
All right.
Yep, there it is.
Hopefully we'll live that long.
We will.
All right. Good night, guys. Thanks again.
Thanks so much. And it's recorded. You can go back and look at it later.
All right.
More to talk about.
Thank you.
Health application.
Yeah, so we'll end off here talking a little bit about health apps. And I just want to point out that, again, like everything else we've talked about, health apps, downloading apps is very tricky at first. It takes a little bit of time to get used to, but going in with the growth mindset will definitely help you with that as well. So in order to download apps on your phone, it depends on what type of phone you have. So for those of you who are using iPhones, you would download it through App Store here, this is the icon, what it looks like. And for Android users, it's normally done through Play Store, and that's the icon for that. And I'll be explaining how to download it for iPhone users, just because that is what I found the most common. But if you have any questions or you want me to walk you through one-on-one for whatever type of phone you have, don't hesitate to email us. The email will be listed at the end of the slides, but it's drkudnew232@gmail.com, and we'd be happy to help you no matter what your device is. So here we'll look at the App Store. So this is essentially a screenshot of someone's home screen, and so if you go on to the App Store, that's the blue icon here. And opening up the App Store on your iPhone will take you through, you'll see a couple of different icons on the bottom of your screen. So we've got updates, search, a couple of different ones. So the main icon when you go on apps is usually what is defaulted when the App Store opens up. And there you'll see all the new apps that Apple has. Sometimes you'll see apps that are currently trending or apps that are the most popular at that time. So you can browse through those as well and see what's new. And to particularly download a specific app in particular, you would go onto the search icon at the bottom. So again, on your screen, you're looking at right at the bottom row. So the search icon will open up this screen here on the very right-hand side, and you can search for whatever the app that you are trying to download is. So Headspace is an app that we're actually going to talk about in a few minutes, but for example, you could type in Headspace, and you'll see this blue button here that says Get. And you simply have to click on that, and it will essentially download the app onto your phone. Sometimes it does ask you for your password of your Apple ID. So your Apple ID, if you're already logged in and your Apple ID is synced in with your phone, it'll automatically download. But in the case that you are not signed in and not synced in with your Apple ID with your phone, I'll just walk you through how to create an Apple ID. So the Apple ID is sort of like an email address, but for Apple, and it's used whenever you have an iPhone, or for Mac users. Essentially, the Apple ID allows you to sync the information on your phone into iCloud and into Apple, and you can access it from pretty much anywhere. And it's also the way in which you can download apps on your phone. So if you don't already have an Apple ID, or you're not synced in your phone, you simply have to go into Settings. So you're going into the settings of your iPhone, and you're going to go down to iTunes and App Store. So these are the different options that you see when you open up Settings. So going down to iTunes and App Store. And if you don't already have Apple ID synced in your phone, you'll likely see all of this blank. So again, Apple ID password is blank here. And if you have an account made, you can click Sign In, and you'll be able to enter in your Apple ID, which is simply an email address and the password you set. If you don't have an Apple ID made, you can hit Create New Apple ID, which will allow you to create that Apple ID email address and that password. This is what the process of creating a new Apple ID looks like. So here it'll essentially ask you for your birthday, your name, and you can just simply hit Next once you've entered in that information. And you can also choose your current email address as your Apple ID if you would like as well, or you can create a new email address through iCloud, which is Apple's email and drive system. So for example, if you already have an email address with Gmail or Hotmail or Yahoo, you can use that same email address here and make that your Apple ID as well. So here we're entering in the Apple ID email address, we're entering in our password, and we're re-entering the password to verify it. You'll notice here password has to be at least 8 characters, mix of numbers, letters, all of that, again, to make your password really strong. And they'll also likely ask you a couple of security questions as well to make your account more secure. So that's how you download apps, essentially, specifically for iPhone users. There's 2 main apps that I want to go through today. The first one being Headspace. So Headspace is an app that is known for mindfulness and meditation. Essentially, this app has guided meditation exercises that focus on breathing and a variety of different exercises for stress or anxiety. And it also focuses on sleep support. So there's information there about sleep hygiene and nightly podcasts. And in their meditation exercises, there's also specific ones for movement and healthy living. So incorporating mindfulness into things like running and walking and eating as well. So I'm just going to show you the website for Headspace so you can kind of get an idea of what sort of content they have. So they have an app, but they also have a website. So this is kind of what their website looks like. So this is the home page. And if you're not sure if it will work for you, you can actually try a couple of their meditation exercises here as well. So you'll notice, for example, they have mini workouts for stress release. They also have different sort of motivational quotes and questions and interviews that they do with individuals. And they have some sleep podcasts and sleep sounds if you have trouble falling asleep as well. And this is the meditation. So I personally have used Headspace to sort of help me get started in mindfulness and meditation. It's very tricky to sort of enter that realm and get used to how meditation works, but I think this app does a really good job because It has very basic sessions that allow you to sort of do small exercises. You can choose how long you want them to be, and you can sort of play around and have someone essentially guide you through them wherever you are. So while Headspace is really great for getting used to how to start meditation and start that journey, the downfall of it is that it does have a premium package that comes with it. So their basic course is free, which includes about 10 sessions that are each 10 minutes. So I think it's a great way to get started. But if you are not willing to pay their prices, that's fine too. You don't have to pay the price. But if you are interested, they do have additional things in their library as well. So Headspace is actually run by a lot of team of health professionals, and so it's been found, a lot of numerous studies have been done on Headspace to find that it really helps with mindfulness and with in changing who you are as a person. So, for example, several randomized controlled trials have found that Headspace has actually decreased individual stress by 14%, increased focus by 14%, increased compassion, decreased aggression, again, through their meditation exercises. So if you're someone who's looking to start that meditation journey, I would really recommend Headspace as that. I'm just going to show a quick video here where you can see sort of what the different tabs look like in the app.
Congratulations on finding some Headspace and taking the time to look after your mind. Get started on the home screen. Your current session is always up top. Below, you'll find everyday Headspace with a new meditation every 24 hours and your recently played exercises. Find new things to try in the Library tab. Choose from the topics in the drop-down menu up top. Meditation Essentials gives you the basics, helpful for beginners and even the more experienced. Search by what you're feeling in the moment. Meditation courses or one-off exercises on everything from stress and anxiety to work and productivity to movement and sport. Or check out the featured topic for our monthly favorites. Our newest addition is Sleep by Headspace. We built Sleep around the needs of restless sleepers. The screen is darker and the buttons are easy to find. Perfect whether you have trouble getting off to sleep or waking up in the night. There are sleep sounds, sleep casts, and special wind-down exercises that are subtly different every time you listen. And we have a library of meditations for kids too, and animations on everything from meditation techniques to the underlying nature of the mind to support, inspire, and guide you in your practice. Track your progress on your profile page. Start training your mind for a happier, healthier life. Just choose a session and press play.
So that's essentially the Headspace app. So simply go into your app store and you can search up Headspace and it should pop up, or you can go on their website to get a little bit more information on their content. So again, this is some of the other tabs you can see here, their basic course and some of their sleep podcasts as well. The second app I'll go over is MyFitnessPal. So this is an app that is essentially for, it's a calorie counter and a diet tracker. And it's really great to help you see your progress in weight control. So I'll just show you what MyFitnessPal looks like here. So again, you can search up MyFitnessPal in the App Store, and this will be the main screen that pops up. So to use MyFitnessPal, you do need an account. So if you already have one, simply click Login, or you can create a new account, which again just requires you to enter an email address and a password. You can actually enter your goal. So is your goal to lose weight, to maintain weight, or to gain weight? And so once you enter in your goal, it'll ask you how active you are currently. So not very active, lightly active, very active. And next, it'll ask you some basic information like your gender, where you live, your birthday, and you can decide how you want to share that data. But it'll ask you for your height and your current weight, as well as your goal weight. So this is the information it uses to sort of create a plan for you and to create an appropriate calorie goal for you for the day. And your weekly goal you can enter in here. So is your weekly goal to lose 0.5 pounds a week, 1 pound a week? It's up to you to choose from as well. And again, the next screen here, you can see entering in your email address, your password, and you're going to hit sign up here. So it'll ask you for all that information about your health, so your current weight, what you want to do, lose weight, gain weight, all of that, and then you'll be able to either sign up for an account through this left screen here or to log in. The second screen you see here, the middle one, is essentially what the home page of MyFitnessPal looks like. So you'll notice there's a couple of like trending articles. So this one here says 10 small ways to be kind to yourself right now. So this is just features from their blog that you can kind of scroll down and take a look at. The third screen here, so essentially if you look at the bottom here is what the icons that I'm referring to. So again, the middle one is the home page. And if you click on the icon at the bottom in this app, you'll reach the diary. So if you get to the diary, you'll be able to sort of add in the meals that you eat during the day. So we have a section for breakfast, lunch, and dinner. And you can see at the top here, you've got the goal calories, the calories you consume with your food, as well as the ones that you burn off during exercise. And then it'll show you the tally of how many you have remaining. So if, for example, I've just finished eating breakfast and I want to add that food into this app, I'm going to hit diary at the bottom here, and we're going to click add food under breakfast. So let's say I had an egg sandwich for breakfast. You can actually search up whatever meal you ate, and they have a big database of all the different foods out there that a lot of individuals are eating. And so you can actually click on these different options that they have. So sometimes in gray underneath the option, it will show you the different ingredients, and it'll also show you the calories on the side, so you can kind of judge to see whether that's kind of accurate to what you've eaten. If you have a particular diet you're following or specific recipes, you can also hit the tab at the top here that says recipes and actually input in your own recipes for future use. So that's also easy to navigate when you just want to use your own. Let's say I hit the first one, Egg McMuffin sandwich, and then it'll essentially, you can actually edit the number of servings you've had. So in this case, I had one, let's say, and it'll show you the different calories and the fat and the protein. And if I click add food, so once I've added that to my diary, you'll notice here that meal shows up under breakfast and the calories are going up here. So you see 300 calories for my breakfast, and essentially it'll keep track. And as you exercise, you can also add in your exercise in your diary, and then it'll automatically calculate how many calories you've burned through exercise and do the math there up there for you. And finally, the third icon here at the bottom is for progress. So the progress icon will essentially show you what your current weight is, and it'll show you a graph of your weight as you progress forward with both your diet as well as your exercise.
So Sonya, I like to go to Harvey's and get their veggie hamburger on a whole wheat bun. So how do I add that to that one?
Yeah, so if it's a specific, for example, restaurant that you're looking for, sometimes you can actually type in the restaurant in the search bar and it'll actually show up the same meal from that. Alternately, there's also a way where you can type in like sort of the individual ingredients as well. So that's also useful for if you're making meals at home. You can type in, for example, the type of like one slice of bread or one slice, a bun slice, and then type white or whole wheat. And then you can sort of individually add up your ingredients. So you would do that through the search bar here. There is a downfall to these sort of diet tracker apps is that they're not 100% accurate. Only you know what you eat and only you know what ingredients are in there and how many calories there are. But I'd say because of the large database they have, they're really good at giving you an approximate idea of your calories. Another thing I'll also point out is that there's a small icon that's not shown on the screen, but it's actually a barcode icon. So let's say you've purchased something or you ate a big box of cookies or something that has a barcode on it. You'll sometimes be able to scan that barcode and it'll automatically sort of calculate those ingredients based on that specific product. So I think that's another helpful tool as well.
Are these Canadian or American versions, or does it matter?
So MyFitnessPal is sort of run by Under Armour, and I believe it is American. So that might make a difference. So if I go back here, when it says where do you live, I think it actually uses your location to kind of track as well what's around you. So in this case, I hit United States, which is why probably the McDonald's McMuffin showed up first. But essentially, if you hit Canada, your options might vary according to the location that you are in.
Fantastic. How's it stop me from eating at nighttime?
So that's my Fitness Pal, and we have time for one more app, or
I'm game. How's everybody else? This is great.
Does anyone have any questions so far?
Any questions, anybody? Keep going.
Okay, one last app. So this one's called Sleep Cycle. This is specifically an alarm clock app that like sort of wakes you up by tracking your sleep pattern. So it actually has a built-in microphone in this app that uses sound analysis to detect your movements at varying times during your sleep. So during a night, you go through various sleep stages, whether that's non-REM sleep stages or REM sleep, which is more deeper sleep. So it'll actually build graphs of what your sleep looks like. So I think this is a great app for individuals who have trouble falling asleep or who have disturbed sleep, for example. So essentially you enter in a 30-minute range of when you want the app to wake you up in. And so let's say you want to be woken up between 8:30 a.m. and 9 a.m. Throughout the night, you can put your phone near where you sleep, and the app will essentially use this built-in microphone to detect your movements and to create a graph. And so it'll try to wake you up in that 30-minute range, depending on where your graph is. So for example, if you're in your deepest sleep right at 8:30 a.m., it'll try to wait until you get to a more lighter sleep and wake you up maybe at 8:45 a.m. instead. And oftentimes individuals, when they wake up, they say, oh, I feel so cranky. I feel like I was just woken up right in the middle of like my perfect deep sleep. That's why Sleep Cycle is so useful, because it sort of tracks your movement, sees when your body would be most likely ready to wake up, and wake you up accordingly within that 30 minutes. Again, of course, downfall is that some of the cycles might not align with 30 minutes, so there's a chance that for those 30 minutes you might be in deep sleep completely, depending on what time you wake up. But it does actually give you really great graphs of your sleep analytics. So for example, first graph is what a regular sleep cycle would look like. So you can see when the individual goes in deep sleep and sort of goes through that cycle. Each cycle usually lasts about 90 minutes during your sleep. And the second shows irregular sleep. So you can see here that individual is sort of all over the place, jumping up and down, and the peaks are not really 90 minutes apart as well. The third example is of untracked sleep. So this is a sleep cycle where maybe the microphone wasn't able to pick up your movements, or you were having trouble falling asleep. So that's what the graph would look like there. And then the fourth example is disturbed sleep. So you can see again, lots of ups and downs and not really what our regular sleep would look like. So yeah, it's important to keep your phone near you when you're doing this with the built-in microphone, and try not to put it underneath a really thick pillow or a mattress, because sometimes the microphone might not be able to pick up your sound. But this is a great app if you want to keep track of sort of how your sleep looks like at night, or even ease yourself into waking up during that time. And with that, I think that's all I have for today. So we went over video conferencing tips, the clinic website, as well as 3 different apps. And I'll just leave you off with this quote here. So never stop learning, because life never stops teaching. I know that this session was probably a lot of information for those of you who are new to technology. I know it might seem very scary and overwhelming to see all these different icons, and even just all the different, how powerful these different features can be. But again, like I mentioned before, I wanted to highlight that technology isn't easy. You will be faced with challenges and with obstacles, but honestly, in our life, there's so many different skills that are yet to learn, and I think technology is one of them that it takes a while to master, and no one really even eventually masters it. If I'm being honest, as I make these sessions, I'm learning so much about these different features myself. So yeah, I think just never stop the drive to continue learning and to be curious about these things because there's still so much out there.
Truly amazing. So before we start these workshops, I said, I don't know. I was a little skeptical. Man, oh man, I'm not anymore. I think this is you can actually learn this stuff, and I got this iPhone that lots of things are added to, and I have no idea what apps I have on them. So my last question is, how do I know what if I look at my phone? How do I find? Do I have an if I have the app on there now? How do I search for the right apps? How do I search my iPhone to find out if I have some of these apps on there or not? How do I do, Sonia?
Yeah, so if you have the app, you'll be able to see it in your home screen. So if you go through the home screen, you'll be able to see the different apps that you have. Another quicker way to search for what app you have is if you go onto your home screen and you swipe left, you should end up getting to a tab that has a search bar. So the search bar should be at the very top.
Okay.
And in the search bar, you can type in whatever app you're looking for. So say maybe you downloaded Headspace a while ago and you don't remember, you can actually type in Headspace into that search bar and see if you have it. So for example, I'm doing it here, the search bar, and I typed in Headspace, and it'll actually show you whether you have that app in your phone or not. And if you don't have it, it actually shows you the option to download it in the App Store as well, right underneath it.
Fantastic. I keep learning. Now, my problem is, what percentage information is retained at a doctor's office? It's less than 10% long term. What percentage are you going to remember of this tonight? I don't know, but you can go back and look at it. And I think one of the things that Paul brought out very early is to record these things. And to try these things. So while we're going through some of these discussions, I was playing around with some of these buttons and stuff. And I think you just have to play and try and realize, have fun, make mistakes. I don't have headspace on my one. I just learned how to find that. Now, what I'll probably do is call you at some time at 2 o'clock in the morning, which will be 11 o'clock your time, and saying, what do I do next? I'm just going to end with one funny story. I have so much stuff in my computer I can't find anything. And one of the backups, it goes to the cloud. And one day I was trying to back something up to the cloud. And I think it was around, I don't know, close to midnight. And my computer screen went blank. I got really nervous. So I did what I could only do is restart the computer. That didn't work. And then I called one of good friends, one of the Rachels. I think I woke her up. She was sound asleep. And I said, I need your help. I thought I broke the universe, my computer, my whole life I thought was gone. And so she tried to make me do something. That didn't work. So went to FaceTime. And then she just took over my computer. And a half an hour later, everything was restored. Apparently, I created some hidden file somewhere and hid everything to a hidden file. How I did that, I still don't know. But make backups and find people to help you. And what this says here, if you want some help, drkernew232gmail.com is something that we keep an eye on. And that actually, Jen keeps an eye on that. So if you have any questions about appointments and things of that nature, you can use that. If you have any questions about technology or different areas, Sonya and her team will help you too as well. So again, think outside the box, think about being different. When we started the webinar, I was trying to figure out what 3 people should be picked up. They all had good reasons. It was a much better solution that Mike, you figured out in 10 seconds, that Paul figured out in 10 seconds. I need a lot of help, and I'm not afraid to ask for help. I do know a lot of things, and I'll tell you what I do know. And that's what makes it so wonderful. So I think we want to, first of all, thank Sonya.
Very good.
It's fantastic. Fantastic. And thank you. I'm looking for the next one. Thank you again, Paul, for making this work. I don't know why I lost the screen. I just kind of came back on and it worked again. Probably because I pushed too many buttons. Notice today, stop, get your hand off your hair there, Mike. Is that is try. Just try to get better and try to make everybody else around you better. And what more can we ask for? And be safe. And how the world's going to look in the next little while, I don't know. But you know, when someone gives you a lemon, you make lemonade. And you guys are doing it. And thank you all. There's Rose for attending. There's Tina and some other people. And I thank you all for your kindness and your support. And we're all working together, and all of you as well. So, Sonya, any final words?
No, I think you've covered it all. Just again, if you have any questions, please don't hesitate to email. It's hard, but we're here to help and we're here to support you. So don't hesitate to email at all.
Have fun. If you're not,
yeah, exactly.
and try different things. Anybody else? Any questions or comments?
Be good to your mothers this weekend.
What's that?
Be good to your mothers this weekend.
Yes, that's right. It's Mother's Day.
Think about them.
Yeah, absolutely.
Think about them.
Yeah, absolutely. And I miss my mom, but I have an adopted mom, and I have many adopted mothers and mothers-in-law and people that made life so special. Paul, you have the last word.
Right, so I want to thank everyone for joining us again. Dr. Kearney said it, Sonya said it, but don't be afraid to fail and try and pick yourself back up. To me, a failure isn't someone who isn't able to do something, but it's someone who gives up. So keep trying at it, keep picking at it. Thank you for joining us. If you have any questions, reach out, and we look forward to having you at our next one for the next 40 years.
Take care. Good night, everybody. Be safe. Have a good weekend. And don't eat too much. Good night now.